My name's Charlie, and I've been in recovery for a while now. Getting up for work every morning. I do it for me, my wife, and the child we're having. I've been on buprenorphine medication. I've tried others, but now I'm taking BUNAVAIL, and it's working well for me. Take the BUNAVAIL foil packet and look at the back, and you'll see the dotted lines. And you'll see there's tiny incisions on it. Fold the wrapper along the dotted line and tear down along the incision. Then just tear down along the other incision and pry it open slowly. You can just pull it right open. Once you get it open, you'll see the medication, a square yellow film. It's flexible and kind of see-through. You want to make sure the writing is facing you, and also make sure your mouth has some moisture in it. Slowly put the film right against the middle of your cheek, with the writing facing your cheek. And you want to lightly press, very lightly press. And try not to let it hit your teeth. I would count 5 seconds in your head. Pull away, and it'll attach to your cheek. And even if I put 2 in my mouth, I do the same thing for each side, just placing the second film on the other cheek, and it'll stay right there, and the medicine gets absorbed into your cheek. As it dissolves, it might feel kind of gummy, but that's normal. Just let it dissolve on its own. Try not to play with it with your tongue. Expect it to take a little while to fully dissolve, but during that time, you can talk, swallow when you need to, and for me, it doesn't taste bad. I can do what I have to, like my morning routine, go to my group therapy session, or just be with my wife and not let it get in the way. I can take BUNAVAIL, and you just wouldn't know.
BUNAVAIL, buprenorphine and naloxone buccal film C3, is a prescription medicine indicated for the maintenance treatment of opioid dependence. BUNAVAIL should be used as part of a complete treatment plan to include counseling and psychosocial support. Prescription use of this product is limited under the Drug Addiction Treatment Act. Keep BUNAVAIL, buprenorphine and naloxone buccal film C3 out of the sight and reach of children. Ingestion of BUNAVAIL by a child may cause severe breathing problems and death. If a child takes BUNAVAIL, get emergency help right away. Do not take BUNAVAIL if you are allergic to buprenorphine or naloxone, as serious negative effects including anaphylactic shock have been reported. Do not take BUNAVAIL before the effects of other opioids, for example, heroin, methadone, oxycodone, and morphine, have lessened as you may experience withdrawal symptoms. Do not drive, operate heavy machinery, or perform any other dangerous activities until you know how BUNAVAIL affects you. BUNAVAIL contains buprenorphine, an opioid that can cause physical dependence. Your doctor can tell you more about the difference between physical dependence and drug addiction. Do not stop taking BUNAVAIL without talking to your doctor. You could become sick with uncomfortable withdrawal symptoms because your body has become used to this medicine. Do not switch from BUNAVAIL to other medicines that contain buprenorphine without talking with your doctor. The amount of buprenorphine in a dose of BUNAVAIL is not the same as the amount of buprenorphine in other medicines. Your doctor will prescribe a dose of BUNAVAIL that may be different than other buprenorphine-containing medicines you may have been taking. BUNAVAIL can cause serious life-threatening breathing problems, overdose, and death, particularly when taken by the intravenous IV route in combination with benzodiazepines, sedatives, tranquilizers, or alcohol. You should not drink alcohol while taking BUNAVAIL, as this can lead to loss of consciousness or even death. Like other opioids such as heroin, methadone, oxycodone, and morphine, BUNAVAIL may produce orthostatic hypotension or dizzy spells in ambulatory individuals. Common side effects of BUNAVAIL include headache, drug withdrawal syndrome, lethargy or lack of energy, sweating, constipation, decrease in sleep or insomnia, fatigue, and sleepiness. Because BUNAVAIL contains naloxone, injecting BUNAVAIL may cause serious withdrawal symptoms such as pain, cramps, vomiting, diarrhea, anxiety, sleep problems, and cravings. BUNAVAIL can be abused in a manner similar to other opioids, legal or illicit. Keep BUNAVAIL in a safe place. Do not give your BUNAVAIL to other people. It can cause them harm or even death. Selling or giving away this medicine is against the law. BUNAVAIL is not recommended in patients with severe hepatic impairment. BUNAVAIL may be used with caution for maintenance treatment in patients with moderate hepatic impairment. Before taking BUNAVAIL, tell your doctor if you are pregnant or plan to become pregnant. If you become pregnant while taking BUNAVAIL, tell your doctor immediately as there may be significant risk to you and your baby. Your baby may have symptoms of withdrawal at birth. Before taking BUNAVAIL, talk to your doctor if you are breastfeeding or plan to breastfeed your baby. BUNAVAIL can pass into your breast milk and may harm your baby. Monitor your baby for increased sleepiness and breathing problems. Your doctor should tell you about the best way to feed your baby if you are taking BUNAVAIL. This is not a complete list of potential adverse events associated with BUNAVAIL buccal film. Please see the full prescribing information for a complete list. To report negative side effects associated with taking BUNAVAIL buccal film, please call 1-800-469-0261. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information, please see the full prescribing information and medication guide for BUNAVAIL, buprenorphine, and naloxone buccal film C3 at bunavail.com.